Comrades and friends, a very good morning to all of you. Last week, we tried to analyze how the budget has treated the education sector. This week, we will try to make a study very briefly the impact of the budget on the health sector. Health and education are the two very important issues that contribute greatly to the Human Development Index. If today India ranks very low in the world in terms of the Human Development Index, it is because of its failing to tackle the real problems of education and health. Now, it is the responsibility of the state to ensure that its citizens get a health care at affordable rate. And this is what the directive principles of the Constitution, Article 39, 42, have mandated the state. But then you take up a position that the directive principles of the state policy is cannot not justiciable in the court of law. That is true. But if you look at the various pronouncements of the Supreme Court in the recent past, the Supreme Court has expanded the scope of Article 21 of the Constitution, which guarantees the right to life of a citizen. And in a number of judgments, the Supreme Court has held the right to health is a part of the right to life, and therefore it is a fundamental right. In fact, in 2019, the 15th Pay Commission appointed a high-level committee to go into the aspect of health and suggest ways and means of improving the health sector in India. And that committee, among various other recommendations, also recommended that health must be made a fundamental right for the citizens, and the government must be accountable to ensure that every citizen in the country receives health care and health care at an affordable rate. Then you also have the National Health Policy of 2017, which also says that it is the responsibility of the state to take care of the health of its citizens. Now, in the background of this, we'll try to understand what ails the Indian health sector. If you have seen the last 2 years in our country, the COVID has totally exposed the fragile public health system in India. We have seen how people were running for the hospital beds. We have seen how people were struggling for the oxygen cylinders and people dying on the roads and the streets. Though the government say that we have tackled the COVID situation admirably well, and in a huge country like India, the death toll is only a little over 5 lakhs. Independent studies by prominent institutes across the world have confirmed that the government statistics are underrated. The government statistics do not give a correct picture, and most of these studies have said that the actual deaths are 6 times or 7 times more than what the official statistics say. And with the Supreme Court saying that all those people who died of COVID, their families should be compensated the applications are being received by various states, and the number of applications that are being received in the various states corroborate the independent studies by various institutions which have put the death toll in excess over 30 lakh. We have also seen that not just the public health system failed, the private sector totally failed to fulfill its responsibility. It did not contribute in any manner to fight the COVID, and it placed the lives of the people in jeopardy. And therefore, what we require is a strong public health system. And when you look at the public health system, you would find that there are various problems for the public health system. One is the lack of infrastructure. Second, that tremendous shortage of the skilled health workers. Number three, that the out-of-pocket expenses are too high for the citizens. So these are the three very important issues that need to be tackled when you try to deal with the health policy in India. Now, if you look around the country, you would find that most of the primary health centers, community health centers in the rural areas are in total shambles. The buildings are in a dilapidated state, there is no facility, no beds, and incidentally, on last Thursday, the NDTV, Ravish Kumar brought a report on the public health system, and he showed very clearly how the public health today lacks infrastructure, how even the sanctioned health centers are under lock and key because there is no facility there. So there is a huge problem with the infrastructure that is necessary for the health services to be given to the citizens. Secondly, there is a tremendous shortfall in the trained health workers. World Health Organization says for every 1,000 people, there should be a minimum of about 2.5 doctors. But in India, for every 1,000 people, you have 0.7 doctors. Totally inadequate doctors. And then when you come to the nurses, the situation is much more serious. The World Health Organization says that for every 1,000 people, there should be a minimum of 3 nurses. But what we see is that for every 1,000 people, we have got 1.7 nurses. And you would be surprised to know that even in the best of the state like Karnataka, you have one nurse catering to the needs of about 40 patients. So there is a tremendous shortage, and the government is not doing anything to fill the vacancies. And it is estimated that 63% of the vacancies of doctors and nurses and the trained health workers in the rural India are unfilled. And similarly, for the urban health centers, the community centers, 39% of the sanctioned vacancies today are unfilled. And this exactly is the problem, that you don't have sufficient number of health workers to deal with the situation in providing a proper health care to the people of this country. So as a result, what do we see? Health is not just about the basic health, it is also about nutrition. Now, when you look at it, the government itself admits the Niti Aayog, the sample survey, National Health and Family Planning Survey, it reveals the fact that 50% of the women in this country are anemic. 50% of the children in this country are anemic. And the reasons all of us know that why they are anemic, because of the lack of nutrition, nutritious food. This anemia is hurting the people. And you also see a situation that nearly about 36% of the children below the age of 5 today in India are stunted, with stunted growth, and more than about 40% have a low weight for their age. And this, when you have to treat the health sector, you have to treat it in combination with the nutrition, because just the health services would not be able to produce the healthy citizens for the country unless adequate nutrition also is given. And this exactly is the problem that the Indian health sector faces today. Now, when you come to the health facilities, a large number of health facilities are now being provided only by the private sector. Government hospitals, the primary health care centers, the community health care centers are not in a position to provide the facilities to the citizens. And when you go to the private sector, what you find is the huge cost for the health services. And that is the reason that even today, 65% of the health expenditure comes out of the pockets of the people who take the health services. And the problem with the private health sector in India is that the doctors and the hospitals, nursing homes, they do not charge the fee for the health services in a similar manner. And that is why some hospitals, for the same treatment, they charge lakhs of rupees. At some other places, for the same treatment, lesser amount is charged. And today, when you have got a regulator for every activity in the country, you have got a regulator for financial services, Reserve Bank, you have got a regulator, IRDA, for the insurance, you have got a regulator for the stock market, SEBI. Why there is no regulator for the health services? Why, like the UK, you should not standardize the health practices and also standardize the fee that need to be paid for the health services? And this, the government is taking, comfort from the situation that over the years, the out-of-pocket expenses are coming down. It is true that the situation has improved, but you have to look at it very carefully, because the poor, at times, they will not avail of the health services at all. And when they don't avail of the health services, naturally, that cost is not accounted into. And because the private sector is charging heavily, the poorer sections will neglect their hair. They do not go to the hospitals at all. This issue also has to be tackled with. Now, how the budget treats it, the budget has allocated for the year 22-23 89,250 crores for the health sector. The government says that this is a increase over the budgeted estimates of the current year's budget, that is 2021 and 22. But when you look at the revised budgetary estimate for the current year, which comes to 88,665, you would find nothing much has been added to the total health budget. Secondly, you also would find that National Health Mission, which is the primary agency to secure the health facility for the people, its budget out of the total health budget is continuously coming down. This year it has come down to 42% when you compare it to 48% of the last year. And then when the National Health Plan 2017 says that by 2025 India must spend 2.5% of the GDP for the health sector, we find that India is spending, both the union government and the state together, less than 2% as of now. And if you take specifically as a percentage of the total budget and the percentage of the GDP, you would be really distressed. So the present budget for 22-23, out of the total budget, the budget allocation for the health sector is 2.26%. And in relation to the GDP, it is 0.35%. And this is less than what it was for 2021-22, when out of the total budget expenditure, 2.35% was allocated to the health and 0.38% was what came as a percentage of the total GDP. So there is a slide back. Now, when you look at the entire budget, there are certain important announcements made. Announcement like mental health, which is very important, especially with huge distress that has come about because of the COVID, and then digital health services, digital health ecosystem, but the matching contribution allocation is missing. Therefore, at a time when health sector is in total disarray, when there is a greater thrust towards privatization of the health sector, every important economist would agree that unless there is a public spending on health, unless the public sector is strong in health, the nation's health cannot be improved. And therefore, this budget totally fails in that direction. It does not create a strong public intervention, a public health system to meet the challenges of the health sector. And this is the biggest failure of the budget as far as the health sector is concerned. So I hope that my submission is of some value to you. We'll meet again. Thank you.